welcome back to my YouTube channel. So today's topic for the video is what is the use of doing pharmacy, why to do pharmacy, and how to utilize the knowledge that is obtained during this 4-year course, or if it's a diploma then 2-year course, or it's a PharmD, so a 6-year course. So basically pharmacy is somebody, a field, or a pharmacist is a person who's actually more in integration with the other healthcare professionals. So the reality of pharmacy is still hidden. The talents of the pharmacist is still hidden. He has knowledge of human anatomy. He has knowledge of chemistry. He has knowledge of pharmacognosy, pharmaceutics, and so many variety of topics. Almost around 14 subjects are being with acquaintance during the pharmacy course of different categories, including the pharm engineering, physical pharmacy, pharmacology, medicinal chemistry, docking, etc. So in today's video, we'll be covering the same. The contents for this presentation would be introduction, the goals, the area of growth, the fields, and the summary. So basically, a pharmacist is a person. He's somebody who is a bridge or a link between all of these physicians, nurses, dentists, the general public, the inpatients and outpatients of hospitals, and the allied healthcare services, the paramedical people, etc. So pharmacist has basically knowledge of certain surgicals as well. They have knowledge of the medications, the drug acts and mechanism of action. How is the drug formed? How does a drug undergo approval, etc. So basically, what are the different subjects that are learned? Pharmaceutical analysis. So whenever there's development of any particular formulation, suppose if it's a tablet or a capsule or parenterals, it needs an analytical validation. So method development for that particular dosage form is extremely essential before the drug comes into the market or the formulation comes into the market. That is why pharmaceutical analysis is taught. Various topics like precipitation titrations and various other titrations, complexometry and all, conductometry, electroanalytical methods, gravimetry, flurrymetry, UV, which is the most widely used analytical method development. The lambda max is useful for determining. And if it's a combination of two drugs, so simultaneous estimation method is mostly chosen for. So on and so forth. So pharmaceutical analysis is of that particular importance. Pharmaceutics in your semester is in semester 1, and then in other point of views it's in sem 3, 4, 5 as well, and sem 6 as well, like physical pharmacy, industrial pharmacy, etc. So in pharmaceutics you basically learn about the different dosage forms like tablets, capsules, parenterals, aerosols, solids, liquids, semi-solids, different cosmetics as well. So basically pharmaceutics, you deal about the regulation, the good manufacturing practices, the method of preparation. Suppose if it's a tablet, so you learn about the punch station of the tablet, rotary punch machine and all. So if it's a capsule, how is the drug or the API filled inside the capsule shell? If it's an aerosol, how is the propellant? What is the system? Water based, suspension based, emulsion based? And if it's a suppository, so what is the base used in the suppository? If it's an ointment or a cream, what kind of emulsion it is? So those kind of stuff will be covered in pharmaceutics, where you will learn about different dosage form, also about novel drug delivery system like liposomes, niosomes, which have enhanced the efficacy of the drugs, because these are all novel drug delivery systems, so they have better bioavailability and efficacy. Next is human anatomy. So in human anatomy, you learn about the different systems inside the body, the cardiovascular system, the CNS system, the endocrinology, and so many systems that I'll be listing now. So these systems are basically in conjunction with the further things that you're going to study ahead. So firstly, you study about HAP. That is, you study about different organs. Okay. Now, in the semesters ahead, you learn about what are the receptors, what are the different types of signaling pathways and all. Then in the pathophysiology, you study about the how is the disease caused, what is the pathophysiology of that disease. Then in pharmacology, you study about the different agonist, antagonist, the terminologies, that are gonna help, what is gonna activate the receptor, what is gonna deactivate the receptor, etc. After you study about this agonist, antagonist, you study about the different drugs that will be used in these diseases. So firstly, you study about the organs on which diseases are occurring. Then you study about the receptors that are involved that can be used for treating the disease. Then you study about the pathophysiology of the disease. Then you study about what kind of drug should be given so that the drug, as so that it is useful, it is of utilization in that disease. And then finally you study about the drugs, the pharmacokinetics, pharmacodynamics, the adverse drug reactions, how is the drug acting on the body, what is the body doing to the drug, the absorption, distribution, metabolism and elimination, the protein binding, volume of distribution, etc. So these terminologies are very, very essential. So that is what HAP is important. So here you have cardiovascular system, you have CNS system, you have endocrine system, you have digestive system, you have respiratory system, you have reproductive system, excretory system. So these systems are extremely essential. Suppose if it's a cardiovascular disorder, so you study about the various, firstly about the organs. What is the heart? Is it a four chamber? How many atria? How many ventricles? How is the blood pressure regulated? What is blood pressure, cardiac output, and other terminologies. So then you study ahead about the pathophysiology of different diseases like like hypertension, hyperlipidemia, coagulants and anticoagulants, fibrinolytics and antifibrinolytics, angina pectoris, arrhythmia. You study about these diseases. And then ahead you study about the receptors involved. If it's a beta receptor or an alpha or a PPAR receptor, are these sodium channels involved or calcium channels involved? And then you study about the different drugs. Suppose if it's a calcium channel, so calcium channel ka blocker you need or a calcium channel ka opener you need. Potassium channel ka opener you need or a potassium channel ka blocker you need. And then in the next semester you study about the different drugs: quinidine, procainamide, nitroglycerine, propranolol, simvastatin, clofibrates, so many different other categories, warfarin, heparin. And these, what are these drugs acting on? The same receptor that you have studied that are involved in the pathophysiology of the disease. CNS mein you have Alzheimer's, you have Parkinson's, epilepsy, mania, bipolar, schizophrenia, depression. So you study about the different neurotransmitters that are involved in these disorders and the imbalance. Which neurotransmitters? Suppose in Alzheimer's, then acetylcholine level is reduced. So what kind of drugs will you give? Certain drugs that will enhance the acetylcholine level. So parasympathomimetics. In Parkinson, the dopamine level is reduced. So what kind? Because it is a neurodegenerative disorder. So what kind of drugs can you give that will enhance the dopa, like levodopa, carbidopa, amantadine, MAO inhibitors, COMT inhibitors, etc. In epilepsy, there is increase in the NMDA receptor, the glutamate levels. So what kind of drugs will you give that will reduce this excitation or that will enhance the GABAergic, so GABA agonist like benzodiazepines, barbiturates, deoxybarbiturates. These all drugs can be given. Similarly, you will study about these. Then digestive. So in digestive, you have so many constipation and diarrhea. These are the two most commonly suffered disorders. And also ulcer. So in ulcers, you give proton pump inhibitors, all the prazoles. You give H2 antagonists. In constipation, basically you give laxatives. And laxative may be isabgulenol, are most widely used laxatives, liquid paraffin. And in diarrhea, so you give antidiarrheal drugs, certain antibiotics like sulfonamides, they are widely used as antidiarrheals. So these kind of drugs can be given. In respiratory disorder, majorly asthma and MSs, these are of primary focus. So in asthma, the levels of the inflammatory mediators are increased. So you give montelukast, the leukotriene antagonist, you give mast cell stabilizer, sodium chromoglycate, etc. And in asthma, also and in emetics. So basically you give certain anti-emetic drugs. Emesis is required when there's poisoning or when there's something that is unwanted that has entered into our system. So at that time you perform emesis. While asthma, asthma is basically something that has narrowed your bronchial pathway. So that is why you give certain bronchodilators that will enhance that will increase the flow of the blood, that will help in bronchodilation, not contraction. So there is more amount of oxygen, so there is more amount of respiration that is occurring. And antiemetics, you have ondansetron, domperidone, metoclopramide that are widely used as antiemetics. Reproductive system, you have certain disorders like erectile dysfunctioning. You need certain oral contraceptives. There are certain hormonal drugs that are used in cancer as well. Corticosteroids have been used. Hormonal drugs like estrogen receptor antagonists, progesterone, anabolic steroids, testosterone, flutamide, estradiol, diethylstilbestrol, mifepristone, stanzolol, oxandrolol. These are widely used hormonal agents. So you need certain erectile dysfunctioning, mesildenafil, tadalafil acts on the phosphodiesterase receptor, the isoenzyme 5. So that is why the receptor is very important. PDE has 3 to almost 5 isoenzyme receptor, 1, 2, 3, 4, 5. So on the third one, there's another drug that acts, and the sildenafil acts on the fifth one. So that is important, that which isoenzyme on the receptor the drug should act on. That is why its structure is made accordingly. So there comes the part of medicinal chemistry where you design the different pharmacophores, where you do molecular docking, molecular modeling, protein modeling, so that you come to know the binding affinity and how strong is the binding score of the ligand to the substrate, of the substrate to the receptors. Excretory system में you have urinary tract infections, you need have diuretics given wisely used as antihypertensive as well. There are certain disorders like glaucoma and also they have been also studied. Similarly, so this was the like a brief overview that why is pharmacy important and how can you utilize these 4 years. So instead of cribbing that अरे हाँ pharmacy MBBS nahi mila, let's do pharmacy. Let's make it more productive. Let's learn something that is actually of actual importance to you. Let's gain knowledge from this. Biotechnology, you study about the vaccines, you study about different immunological systems, MHC complexes, the type of hypersensitivity reactions. You study about the monoclonal antibodies that have been widely used nowadays, omalizumab, daclizumab, anti-cancer, anti-asthmatic. So they are very, very important. Microbiology is basically uh, studying of your fungi, bacteria, virus. So before targeting, like before making antibiotics, antimicrobials, etc., you need to know about the nature of the fungi, aerobic, anaerobic, gram positive bacteria, gram negative bacteria. Also, it can be used for diagnosis. So gram staining, acidiphage staining are what you learn. Culture media, sterilization methods. So there are certain equipments that needs to be sterilized before used in autoclave or hot air oven. That is extremely important, your glass containers and all. So that is why my microbiology has been introduced. Pharmacognosy study of all the herbal drugs and all the different naturally occurring medications that have been useful, like suppose Vinca, so vincristin, vinblastin, taxane, taxols, etoposide, podophyllitoxins, which is a lignat. Then you have so many different other categories, digoxin, which is used in congestive heart failure. You have so many different secondary metabolites, primary metabolites. You have alkaloids, tannins, glycosides, terpenes, flavonoids, volatile oils, resins. They have antioxidant property and also they can be used as anti-cancer as well, like amla. It has tannins, also flavonoids, they have tannins, they can, so there are so many different they have antioxidant property as well. So these are what is the importance of pharmacognosy. And then you study about the standardization methods as well for certain asava, arishtha, ayurvedic formulations. And you know about the different evaluation parameters of a drug. Like suppose if you're obtaining a crude drug, how will you believe that this powder is vincristin? How will you believe that this powder is of uh, this particular drug only if it's suppose reserpine? So how will you come to know that this powder is from Revolvia serpentina? So authenticity can be measured using different evaluation parameters like macroscopic, organoleptic, quantitative, qualitative, etc. Biochemistry में you basically have to study about the different carbs, proteins, lipids, their classification, the Krebs cycle, glycolysis, glycogenolysis, gluconeogenesis, and all those terminologies. OC and medicinal chemistry, you study about the name reactions. Why are these reactions important? Because they help in synthesizing the molecules. They can reduce the number of steps involved. Green chemistry is nowadays a boon field using microwave oven like phenytoin. So different name reactions are involved, like thiophene. Suppose if you want to make a heterocycle of thiophene, so you must know about Hinsberg synthesis. If you want to make some Haworth synthesis, so you must know that it is useful for rings like naphthalene, anthracene, phenanthrene. So that is importance of the name reactions that you study, or Grignard and all. So that is why medchem, of course, the structure. Suppose if I have this one structure as benzene, so the OH group is over here. Now, if I'm attaching a ammonia, amine group, so which position to attach, ortho, para, meta, and at what position is it going, showing good activity or the best activity and with the minimum side effects? So that is what medicinal chemistry deals with, the structure of the drug. So that because what is pharmacy and what are drugs all about? They are all about molecules, molecules that make up a structure, and that structure is what is important in a particular medication treatment. Farm engineering may you study about the different unit operations like mixing, drying, centrifugation, filtration, size reduction, size separation. Pharmacology, as I previously mentioned, you study about the different drugs, you study about the poisoning, the antidotes, you study about the chronopharmacology, the how the day, suppose if it's sedative hypnotics like alprazolam or phenobarbital, it is advised to take them at night. Why so? Because it has a chronopharmacology with the time, with the day and night system. So that is why if it's a prazole, it's omeprazole, it is usually to be taken in the morning, like after before the lunch. So before the lunch, 1 hour or half an hour before. Why so? Because it needs to be taken empty stomach, and the acid, and it's a pro drug. So the acid secretion needs to be reduced. So that is the reason it is taken half an hour to 1 hour before. Cosmetics may you study about the different cosmetics, sunscreen, mascara, lipsticks. So those who are interested in dermatology and all, so for them cosmetology. So sunscreen, lipsticks, all those imported different kinds of makeup products, mascara, eyeliner, eyebrow contour, bronzer, face powder, compact, foundations, moisturizing, vanishing, cleansing, all-purpose cream. There are so many different products that could be included in cosmetics. Jurisprudence means you basically study about the different acts and ethics of pharmacy. Drug and Cosmetic Act, Drug and Magic Remedies Act, Dangerous Drug Act, Poison Act, Opium Act, Medical Termination of Pregnancy, Narcotic and Psychotropic Substance Act. So these are the different acts that you will be learning ahead. Pharmaceutical management is all about your MBA and the marketing of these pharmaceutical companies. So if you are interested in MBA types of work, so pharmaceutical management is a subject that's made for you. Being a biostatistician is very important because in cohort studies, in various observational and experimental studies of clinical trials, you learn about the different types of biostatistics, ANOVA test, T test, Z test. There are different tables. So for these are evaluation tables that help you take an idea that from a particular sample obtained from this particular population, this is the epidemiological prevalence, incidence, or the risk ratio. So that is what is importance of biostatistics. Social and preventive is very, very simple pharmacy term. Like how is the community? What are the different programs available? Pulse polio program, universal immunization program, national program for healthcare of elderly, tobacco control program, malaria control program. So these are different programs that you learn under social and preventive pharmacy. What are the good hygiene practices? What are good health practices? Pharmacovigilance means you study about the different ADRs. So there are certain side effects and there are certain ADRs that are associated with any drug that you have. It has certain reactions. Suppose dizziness or vomiting, lethargy, nausea. There are certain disorders that are fatal as well, gray baby syndrome and all. So that is what you learn in pharmacovigilance. PIC में you learn about the different hematinics, expectorants, antitussives. that is drugs given in cough. You learn about the different terminologies of antidotes and poisoning. Then you learn about the radiopharmaceuticals, the iodine 131 useful in thyroid cancer and all. So this is important from the PIC point of view. Computer applications may you basically have a different bioinformatics that is very important from pharmacy point of view. That is a thing that you study. Biopharmaceutics, you BPP gave biopharmaceutics and pharmacokinetics. You study about the different pathways of absorption, paracellular, intercellular, transcellular, intracellular, and vesicular distribution. How is the drug after you take a tablet of paracetamol? How is it getting dissolved, solubilized? After it gets dissolved, solubilized, the absorption and the bioavailability, the distribution, what all the organs it's getting distributed, liver, lungs, kidney. That is why it causes liver toxicity if it's in excess. Metabolism, how is it metabolized? What are the different conjugates obtained? Or what are the different metabolites of paracetamol? Elimination, how is it getting eliminated? The different routes of elimination: milk, tears, sweat, saliva, urine, feces. So the mode of elimination, that's important. Quality assurance, may you study about the different terminologies of ICH guidelines, WHO guidelines. And in quality assurance, you basically it's very necessary for IPQC. So whenever you prepare a tablet, there are certain tests that you perform: hardness, dissolution. Then in the containers that you choose, glass, plastic, rubber. So these containers are safe. How will you come to know? So quality assurance, quality control is something that will help you to validate the authenticity, evaluate, analyze, examine. So these are different terminologies, retrospective or prospective, irrespective, but it will help you basically. Pharmacy practice, you study about the different techniques of patient counseling, the therapeutic drug monitoring. Certain drugs have narrow therapeutic index and they are of drugs of abuse and all. So to monitor the drugs level in the body, you need therapeutic drug monitoring. How will you counsel a patient when he comes to you? Beginning a conversation, during the counseling, ending the counseling, the behavior, the expressions, the gesture, the terminologies used. How are you going to present your counseling session? So that is what is learned in pharmacy practice. CAD may you study about the different drugs, the different docking softwares, PyMol, OpenBabel, Schrodinger, MOE, RASMol, MolMol, and all. These are the different software that are used for docking. Nutraceuticals may you study about the spirulina, kava kava. So these are different nutraceuticals that are useful nowadays, that have been used to prevent the diseases. So they are quite useful. Probiotics, antioxidants, puffa and all. Personality development and communication skills is also a small subject that is involved in the syllabus, so that as a pharmacist, the overall development is extremely essential, because you need to communicate, you need to coordinate with different health experts. So you must be well versed, you should be thorough with your knowledge, you should be having a good body language. That is why this subject was incorporated. Next up we have is different fields in which you can work. So as a dietitian, you will have knowledge of different foods, what are the different obesity, anti-obesity agents, drugs and all. Cosmetology, dermatology, cosmetics ka knowledge. Biostatistician, analyst, government analyst, drug discovery may you will be helpful, clinical trials may you will be helpful. You will be a mini doctor, so and a nurse as well, like you can measure the blood pressure, you can measure the blood glucose level. All this could are being taught to you during the syllabus. And if there's a certain condition, like if it's suppose cold, so cetirizine, you should know that levocetirizine was that could be taken in that condition. So uh, immediate treatment or the course of action could be taken. Forensic pharmacy, of course, forensic pharmacy is also taking a quite good boon. Military and veterinary pharmacy, formulation and development, F&D, R&D. You can design new formulations, you can do research and development, find out new moieties, find out new medical devices and all. Teaching, of course, that's a most common field. Drug inspector, marketing, you can go into MBA side. Clinical pharmacy, where you will study about the different experimental designing and all. Blind study, cross-sectional documentation and all. Hospital pharmacy, where you inpatient, outpatient, satellite pharmacy, you will get a one-on-one interaction. You'll get with like internships help give you an idea of what are you gonna learn. Social and community pharmacy, of course, you can be a community pharmacist as well. So what are the different types of pharmacy fields? Clinical, hospital, medical, industrial, marketing. Industrial mate will foster holistically the superior methodologies. Like if you come out with a new process that is much more easier, simpler, or more fine. Like suppose in tablets, first there were so many metal parts that were that were not deliberately incorporated, but they used to be inside the tablet because the punching machine parts used to get shredded. So now there are metal detectors that are attached. Similarly in sonicator, so there's a lot of noise when a sonicator is on. So now the soundproof casing for sonication is provided. So that's what is important with respect to industrial, medical, hospital, clinical, as etc. So you go through various projects, you go through various internships, and you learn a lot from pharmacy in these 4 years. So make it your best. Of course, enjoy your days, all your festives, all your different college fest and all. But with that, you do some research, participate in the competitions, extempos, review, short communications, debates, poster, develop a critical thinking skill and problem solving ability. That's a very good peculiarity that as an individual you should have. You will get acquaintance with a lot of generic and brand names, how the drugs are acting, how to design a drug, what are the ways of drugs approval. So this was all about pharmacy and how is the knowledge useful in your real life, in your actual life. How can you use that knowledge? How can you optimize that knowledge? So that's all for today's video. You can contact me via my SlideShare account or via my Instagram, Best Pharmacy Tips and Tricks. You can mail me as well for any collaborations. Thank you so much for watching the video.